Hey guys, how you doing? Oh my god, I have not posted on this channel for so long, but trust me, I've been focusing on business, I've been focusing on my students, and it has been a rough journey. But listen, it has been an amazing journey, but you know, like learning business, it needs a lot of attention, marketing and sales, all that stuff, customer service, oh my god. But listen, this is not our topic for today. If you want to hear some business talk, you should go and be on my Patreon. I'm going to put a link down below. Check my Patreon, be a member, $5. It's not much, but then you will get all the business content. All right, today we're going to talk about, work-related anxiety, burnout, stress. I don't want to say bullying, but listen, so anxiety, burnout, and stress at work. Especially for those nurses who want to prove themselves, who are not that confident, have low self-esteem, and then when another colleague jumps in, they freak out and they start, they start want to be in a defensive mode. They want to defend themselves, whatsoever. Listen, you need to work on your self-esteem. This is what it comes to. If you want to work on your anxiety, your stress, and burnout at work, I would suggest that you work on your self-confidence, okay? And how do you boost your self-confidence? You boost your self-confidence with knowledge, period. If you are knowledgeable, if you know what you're talking about, if you know how to take care of your patients, your anxiety levels will be low, your stress will be low, and you will not burn out because you know what you're doing. You can do time management is huge. And if you are not confident and if you are all over the place, your time will be wasted like that. So what I would suggest for everyone out there, if you are international or you are just like a new graduate from nursing school and you are about to get your first job, boost your self-confidence. The only way to boost your self-confidence and prevent stress, burnout, all that type of stuff is your knowledge. So let's say you are working in a med-surg area or you are working in a critical care area. Listen, you've got to know your stuff. You've got to know mechanical ventilation. You've got to know ABGs. You've got to know ECG. You've got to know communication skills with a patient, verbal and nonverbal communication, with you and your patient. You've got to know, quality standards. You've got to know when you get skin integrity, Glasgow Coma scale. There are a lot of stuff that you need to know. If you don't, trust, as simple as physical exam, head to toe physical examination. If you don't know that, oh my God, you don't have any self-confidence. And if you encounter any situation with a colleague, with your charge nurse, with your head nurse, and they ask you a question, why did you do that? And you cannot explain yourself because you don't have the knowledge, or you're going to say, I don't know, man, that shit will get you in trouble. And, some nurses will start fighting back, and that fighting back and being in a defensive mode instead of reflecting on their situation. And you always, when you encounter a situation, you need to step back, reflect on it, and, count to 3, count to 10 before responding to any email, before responding to a colleague, to a manager. So it all comes to knowing your craft. So another example, if you are an oncology nurse, right? If you are an oncology nurse, you work in a cancer center and you encounter a situation, you're new to the whole oncology stuff and you don't know what's going on, right? You need at least a year to a year and a half to learn oncology and be confident and whatsoever. It doesn't matter if you were working in another department and you have 10 years of experience. If you come to oncology, and a lot of you experience that. Me, myself, I worked in critical care, bone marrow transplant, pediatric, adult, oncology. I've never worked in med-surg, and I got a job in med-surg, and oh my God, I felt as a novice nurse. So there's nothing to be ashamed of, right? If you are new in oncology, there's a lot of things you need to learn, all right? Most important stuff are chemotherapy and certain diseases. So if you don't know chemotherapy and you don't know the side effects of chemotherapy and you don't know what you're gonna look for, that's fine. Don't fight back. Just learn the information. Just chill down, learn the information, be humble, say I'm new, say I didn't know that, see, I'm gonna read about it, thank you for telling me. These are the words that you need to use. So, I tell everyone, listen, nursing is not easy, right? It's easy, but it's not easy. It's only easy if you put the work in. It's only easy if you are willing to sacrifice, you know, like your off days to read material, if you are willing to read more, I mean, what you study in nursing school, it's nothing. Literally, it's nothing. If you are new to critical care, there's a lot of stuff that you need to know, you know, and experience will teach you what are the things that you need to focus on, right? There are some rare stuff that you're not gonna see. You don't want that. You want the basics. You need to know how to read an ECG, right? You need to know compensated, uncompensated. You need to know that stuff. So chill, learn your craft, be knowledgeable. And if you are international, you guys are amazing because you know a lot of stuff. But when you come here, don't just, you know, stick your nose up. There's a lot to learn. So be humble. Every day I learn new stuff. I've been a nurse for 12 years now, but every day I learn new stuff. And, you know, always stay humble. You will love it. You know, working in nursing is amazing. For me, I love it so much that, you know, every single day when I go back home, I just chill like that a little bit and start thinking about the patients that I've helped. Did I relieve that patient's pain, or helped with the anxiety of that patient, or fear? Or, you know, like now with the holidays and stuff, you know, before the weekend, people are calling like they're just anxious, and you talking to them, you know, doing patient education and relieving their anxiety and fears. It's huge before the holidays, because it doesn't matter if I stay with a patient on the phone for like 30 minutes, and, you know, trying to work on his anxiety so that he can enjoy his weekend or enjoy his holiday. That's huge to me. You know, when I go back home, I sit back and I reflect and I say, oh my God, I literally helped like 3-4 patients today. I made a difference in their life. That's why I love nursing. It's not about the money. Yes, there's good money, you know, in nursing. Yes, there is, you know, you are respected in the community. You work with professionals like doctors, dietitians, other nurses. But what is important to me is that moral satisfaction. When I go back home, you know, end of the day, and think or reflect about my day, I sleep on my pillow like I don't know how to express myself, but that's what nursing means to me. That's why I get up in the morning and go to work every single day, just for that single feeling. And I would have never chosen, I mean, I didn't choose nursing. Nursing chose me. And if I had the option to choose something else, I would not choose anything else over nursing. So I love your faces. I'm sorry it has been long. This video is not edited. This is like ranting, you know, like, what is it? I just miss you guys, right? There's no editing in this video. I'm from my phone. I'm gonna post it right away. I hope you guys enjoy it. Show love. Drop a comment down below. Hit a like. Share it with your friends. You know, help me grow this channel. We want to explore. We want to reach as much nurses as we can. And if you have any of your friends sitting for their NCLEX and NPN, RN, listen, this is your boy. He's helping tons and tons of nurses. I don't want to see tons. I want to say hundreds of nurses pass their NCLEX. And literally every week we're getting a testimonial of someone who passed after they attend my 4-week crash course. We in business, we're having huge goals that we want to attend in 2019. We have a great vision. It's not just NCLEX. It's, hey, you're gonna hear soon. All right, until next time, be an alpha slice.